Namaste Vidya. Hamisha Khush Rao Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI Vidyapeeth Women's University, Jaipur. In today's lecture, we are going to start with mitral stenosis. Mitral stenosis is the narrowing of the mitral valve opening that blocks or obstructs the blood flow from the left atrium to the left ventricle. So this is basically the narrowing of the mitral valve opening, and that blocks or obstructs the blood flow from the left atrium to the left ventricle. It can be caused by heavy calcification of the mitral valve apparatus. A rare form of congenital mitral stenosis, and in the rheumatic mitral stenosis, the mitral valve orifice is slowly diminished by progressive fibrosis, calcification of the valve leaflets, and fusion of the cusps and subvalvular apparatus. This is the anatomy of the mitral valve, where we have the anterior annulus, the anterior leaflets, anteromedial commissures, there are posterior lateral commissures, posterior leaflets with 3 lobes, there are posterior annulus, the lateral papillary muscles, chorda tendini, and the medial papillary muscles. The mitral valve orifice is normally about 5 cm square in diastole. The patients usually remain asymptomatic until the stenosis is less than 2 cm square. An increase in the heart rate shortens the diastole when the mitral valve is open and produces a further rise in left arterial pressure. Reduced lung compliance due to chronic pulmonary venous congestion contributes to the breathlessness and a low cardiac output. Atrial fibrillation is due to progressive dilatation of the left atrium is very common. This is the anatomy of the heart, basically the heart in diastole that is viewed from the base with atria removed. So you can see the pulmonary valve in here, and you can see the aortic valves, and you can see the mitral valve and the tricuspid valve. So the anatomy you have already studied in your first year anatomy section, so there is no need to discuss it again. But this is just a revision. Now, what are the clinical features of mitral stenosis? The mitral stenosis is represented by breathlessness, there is fatigue, edema or ascites, there is palpitations, hemoptysis, cough, chest pain, and thromboembolism. We have breathlessness, we have fatigue, edema, ascites, palpitations, hemoptysis, cough, chest pain, and thromboembolism. Other clinical features include atrial fibrillation, there can be mitral feces. First heart sound can be loud and due to the opening snap. There is mid-diastolic murmur, there can be crepitations with pulmonary edema or effusions, right ventricular heave, and loud P2. Now, what are mitral facies? You can see in this picture. Sometimes the patient with mitral stenosis have a dusky red or purple tinge to their cheeks. This sign is neither sensitive, as many patients with mitral stenosis do not have it, or specific, as there are many other reasons for its appearance. It results from the delicate small blood vessels within the skin over the cheeks. When it does occur, it usually is associated with moderate or severe mitral stenosis, and many believe it results of long-standing pulmonary hypertension, because other causes of pulmonary hypertension may also lead to the appearance. A chronically low cardiac output that is associated with severe mitral stenosis may contribute. There are various other causes. We need not to go into the detail. Mitral stenosis, there is high left atrium pressure that causes loud heart sound 1. Pulmonary venous hypertension, there will be pulmonary arterial hypertension and right ventricular hypertrophy, with tricuspid regurgitation and right heart failure. Now, what are the various investigations that could be done in this case? The various investigations include the ECG, that is atrial fibrillation, right ventricular hypertrophy. We have chest X-ray with enlarged left atrium, signs of pulmonary venous congestion. In echocardiography, there will be thickened immobile cusps with reduced rate of diastolic filling of left ventricle, reduced valve area, enlarged left atrium. In the Doppler, you will see the pressure gradient across the mitral valve. There will be cardiac catheterization with coronary artery disease, mitral stenosis, and regurgitation. Now, what is cardiac catheterization? Here, the catheter is introduced. You can see the insertion sign in also the alternate size, where the narrowed artery and on the X-ray can be viewed. Now, how to manage the case of mitral stenosis? The various medical management includes anticoagulants, ventricular rate control by giving digoxin, beta blockers, or rate limiting calcium antagonist. In the atrial fibrillation and diuretic therapy, that includes balloon valvuloplasty, mitral valvotomy, and mitral valve replacement. So this was all about mitral stenosis, and in the next topic we will start with a. In the next lecture, we are going to start with a new topic, especially of the CVS system only. So this session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.